Do you ever find yourself just tired? Not just a little bit, but truly bone-deep exhausted, even after a good night's sleep. Or maybe you've dismissed that nagging ache in your jaw, or a little swelling in your ankles, as just another sign of getting older. We often tell ourselves these things are normal, a natural part of the journey through our golden years. But what if I told you that some of these seemingly innocent symptoms, the ones we often shrug off, could actually be urgent whispers from your heart? The truth is, our bodies are incredible communicators, and after 60, those communications about our most vital organ can become a little more subtle, a little stranger, and tragically, a lot easier to miss. This isn't meant to alarm you, but to empower you, to give you the knowledge that could literally change your life. In this video, we're going to uncover 6 of these often overlooked, strange symptoms that might be revealing your heart is in trouble, especially after 60. Understanding these signs isn't about fostering fear, but about fostering awareness and taking proactive steps for your well-being. So please, watch to the end for something that will truly surprise you about your heart health. Let's dive right into the first symptom, one that many of us, especially as we age, are quick to dismiss: unexplained and persistent fatigue. Now, I'm not talking about feeling a bit tired after a busy day with the grandkids or a long walk. I'm talking about a profound, pervasive weariness that settles deep in your bones, making even simple tasks feel like monumental efforts. You might wake up feeling like you haven't slept at all, or find yourself completely wiped out after just a short trip to the grocery store, an activity you used to breeze through. For many, this fatigue is simply chalked up to getting old or a busy schedule, and often ignored. But when your heart isn't pumping blood as efficiently as it should, your body's tissues and organs aren't receiving enough oxygen and nutrients. Imagine your heart as a tireless pump. If that pump starts to falter, it has to work harder to circulate blood, even at rest. This extra effort can drain your energy reserves, leaving you feeling constantly sapped. It's not just physical exhaustion, it can be mental too, making it harder to concentrate or feel motivated. Think about it: if you're suddenly struggling with activities that used to be easy, like climbing a short flight of stairs, walking across the house, or carrying a light bag, and rest doesn't seem to help, that's a red flag. It's your body whispering that something might be off with its main engine. It's crucial not to simply push through this type of fatigue, telling yourself it's normal. Instead, pay attention. Keep a mental note or even a small journal of when you feel this exhaustion, how long it lasts, and what you were doing when it started. This information is invaluable for your doctor. Don't hesitate to bring it up, because while aging certainly can bring changes in energy levels, this kind of persistent, debilitating fatigue can be a serious indicator that your heart needs attention. Moving on from that profound tiredness, let's talk about another symptom that's often easily dismissed: swelling in your legs, ankles, and feet. We've all had those days where our socks leave a bit of a mark, or our shoes feel a little tighter by the end of a long day, especially if we've been on our feet a lot. And it's common for people to attribute this minor puffiness to standing too long, or maybe just the summer heat, or even simply poor circulation that they assume is a normal part of getting older. But when that swelling becomes persistent, noticeable, and doesn't go away with rest or elevation, it could be a sign that your heart isn't pumping blood effectively. When your heart struggles to keep blood flowing adequately, fluid can back up in your veins and leak into surrounding tissues. Because of gravity, this fluid tends to accumulate in the lower parts of your body, leading to what doctors call edema. You might notice your ankles looking puffy, your shoes fitting uncomfortably tight even in the morning, or deep indentations left by your socks that linger for quite a while. Sometimes, this swelling can even be seen in your abdomen, causing a feeling of bloating or fullness. What makes this symptom particularly strange is how easily it blends into the background of everyday life, often dismissed as harmless. But it's not always harmless. This fluid buildup puts extra strain on your body and can be a strong indicator of heart failure, where the heart muscle has become weakened or stiff and can't pump enough blood to meet the body's needs. If you're seeing this kind of swelling, especially if it's new, worsening, or accompanied by that unexplained fatigue we just discussed, it's not something to ignore. Simple actions like elevating your legs can offer temporary relief, but they don't address the underlying cause. It's a critical moment to have a conversation with your healthcare provider. Your heart is communicating with you, and understanding this particular type of swelling is a vital step in listening to what it has to say. It's truly eye-opening how varied these signs can be. Isn't it now that we've shed light on fatigue and swelling? Let's move on to another often misunderstood sign, a persistent cough or wheezing. When you hear someone cough or wheeze, your first thought probably jumps to allergies, a cold, bronchitis, or even asthma, especially if they've had these issues before. And indeed, these are common causes. However, a persistent cough, especially one that produces white or pink-tinged mucus, or a new onset of wheezing, can actually be a subtle yet serious symptom of heart trouble. Here's why: if your heart isn't pumping blood efficiently, fluid can back up into the lungs. This buildup of fluid irritates your airways and can trigger a cough reflex, much like a cold would. But it's not caused by an infection. This cardiac cough is often chronic, meaning it lingers for weeks or months, and might even worsen when you lie down because gravity allows more fluid to settle in your lungs. You might find yourself coughing more at night, interrupting your sleep, or feeling like you always have a tickle in your throat. The wheezing, similarly, comes from the fluid buildup making it harder for air to pass through your airways, creating that whistling sound. It can be particularly confusing if you've been diagnosed with a respiratory condition like asthma or COPD, as you might assume it's just a flare-up of your existing condition, and treatments for those might not bring relief to a heart-related cough. This is a classic example of a symptom being strange because it mimics something entirely different, leading people down the wrong path. If you have a cough or wheezing that doesn't clear up, isn't responding to typical remedies for colds or allergies, or is getting worse, especially when lying flat, it's absolutely vital to consider your heart. Don't just dismiss it as smoker's cough or just getting older. Mention it to your doctor, particularly if you've also experienced any of the other symptoms we've discussed, like the fatigue or swelling. It's about connecting the dots, and sometimes those dots lead straight to your heart. Next, let's talk about jaw, back, or arm pain, particularly in women. But men should pay attention too. We often associate heart attack pain with the classic image of someone clutching their chest, feeling a crushing pressure. And while that's certainly a common presentation, many heart-related pains, especially in people over 60 and notably more so in women, can be much more subtle and appear in unexpected places. You might feel a dull ache in your jaw, sometimes radiating up into your ear or down your neck, or perhaps you experience discomfort in your upper back, between your shoulder blades, or even a pain in one or both arms, not just the left one, that you dismiss as a pulled muscle or arthritis. These strange locations for pain are due to how our nervous system works. The nerves carrying signals from your heart can sometimes get confused with nerves from other parts of your body, leading to what's called referred pain. Your brain interprets the heart's distress signals as coming from your jaw, your back, or your arm. Think about how often we might blame a stiff neck on sleeping awkwardly, or a backache on overdoing it in the garden, or arm pain on simply carrying too many groceries. These are all valid reasons for aches and pains in those areas. But when the pain is new, unusual for you, or accompanied by other symptoms like shortness of breath, sweating, or lightheadedness, it's time to be highly suspicious. The pain might not be sharp. It could be a persistent dull ache, tightness, or pressure. For women, this type of pain is incredibly common during a heart attack and often leads to a delayed diagnosis because it doesn't fit the stereotypical picture. It's a critical reminder that your heart problems might not announce themselves with a dramatic chest grab. They can be subtle, mimicking everyday discomforts. If you experience new, unexplained pain in your jaw, back, or arms, especially if it's accompanied by that strange feeling of unease or other warning signs, don't take chances. These are the moments when it's better to be overly cautious and seek medical advice immediately. It's your heart doing its best to get your attention, even if it's speaking a language you don't immediately recognize. It's truly a testament to the complexity of our bodies how these seemingly unrelated symptoms can point to a common issue. Continuing our journey through these strange signs, let's consider something most of us have experienced at some point: nausea, indigestion, or stomach pain. You might be thinking, stomach issues. That's about my digestion, not my heart. And you'd be right. Usually, we often chalk up a sour stomach to something we ate, stress, or maybe a touch of acid reflux, especially after a certain age when digestive systems can become a bit more finicky. But this is another one of those strange symptoms that can throw us off the scent, particularly when it comes to heart health. And again, it's disproportionately common in women experiencing heart trouble. When your heart is struggling, particularly during a heart attack, the pain can sometimes radiate to your abdominal area. This might manifest as general stomach discomfort, a feeling of indigestion, heartburn-like sensations, or even outright nausea and vomiting. The heart is a powerful muscle, and when it's under distress, the signals can get jumbled. Sometimes, the reduced blood flow to the digestive system during a cardiac event can also cause these stomach-related symptoms. Imagine a feeling of uncomfortable fullness, pressure, or a burning sensation in your upper abdomen that doesn't quite feel like typical heartburn. Or it's accompanied by other unusual signs like sweating, shortness of breath, or that unexplained fatigue we discussed earlier. It might not even be severe pain, just a persistent, unsettling discomfort. It's easy to pop an antacid and hope it goes away. But if these symptoms come on suddenly, are severe, or occur alongside other alarming signs, it's a serious red flag. Don't hesitate to seek immediate medical attention if you suspect it could be more than just a bad meal. Your digestive system might just be your heart's way of signaling trouble in an unexpected place. Finally, the sixth strange symptom we need to talk about is lightheadedness or dizziness. Most of us have felt a little dizzy when standing up too quickly, or perhaps if we haven't had enough to eat or drink. It's a common sensation that's often dismissed as dehydration, low blood sugar, or simply a momentary imbalance. But persistent or recurrent lightheadedness and dizziness, especially when it feels like you might pass out, can be a clear signal that your heart isn't doing its job properly. When your heart isn't pumping enough blood, your brain isn't getting the consistent supply of oxygen-rich blood it needs. This can lead to those woozy, faint feelings, a sense of unsteadiness, or a sudden loss of balance. It can be caused by various heart conditions, such as arrhythmias, irregular heartbeats that affect blood flow, or problems with heart valves that aren't opening or closing properly, or even heart failure that reduces overall pumping efficiency. These episodes might come and go, making them easy to disregard. You might find yourself feeling lightheaded when you exert yourself, or even when you're just sitting down. For older adults, there's often a tendency to attribute falls or near falls to general unsteadiness. But sometimes, the root cause is cardiovascular. It's a strange symptom because it doesn't immediately scream heart problem to most people. Instead, it might be brushed off as just a little dizzy spell. But a dizzy spell that causes you concern, that happens frequently, or that's paired with other symptoms like chest discomfort, shortness of breath, or palpitations, should never be ignored. It carries a real risk of falling, which can have serious consequences on its own. So, if you're experiencing unexplained lightheadedness or dizziness, It's time to talk to your doctor. Don't wait for a fall to happen. Your brain is giving you a critical alert that its blood supply might be compromised. And often, the heart is at the center of that issue. So, there you have it. We've talked about how those nagging feelings of unexplained, persistent tiredness, the slight swelling in your legs and ankles that just won't go away, a persistent cough or new wheezing that you can't shake, an unusual ache in your jaw, back, or arm, a surprising bout of nausea or indigestion, or even a sudden spell of lightheadedness and dizziness might actually be your heart asking for help. These aren't meant to scare you, but to empower you with knowledge. Knowing these strange symptoms, the ones often overlooked because they don't fit the classic picture of heart trouble, is the first and most vital step towards protecting your most vital organ. Your body is always communicating with you. Sometimes, it just speaks in whispers rather than shouts. And after 60, those whispers become even more important to tune into. Remember, you are resilient, and your health is your greatest treasure. Small changes, and more importantly, proactive steps rooted in awareness, can make a huge difference in your journey towards sustained health and happiness. Don't dismiss these signs as just getting old. Embrace this knowledge and use it to advocate for your own well-being. If any of these symptoms resonate with you, or if you notice new, persistent, or worsening sensations, please reach out to your doctor. They are your partners in health. And early detection can be life-changing. We'd love to hear if any of these symptoms surprised you, or if you've had an experience where a strange symptom turned out to be related to your heart. Share your thoughts in the comments below, because your experiences can help others too. And if you found this video helpful, please give it a thumbs up and subscribe to our channel for more valuable insights to help you live your best life at every age. Remember, every day is a chance to nurture your most vital organ. You deserve a healthy, vibrant life. And with this knowledge, you're better equipped to achieve it.